Hello, my name is Dr. Daniel Bruns, and I am a pain psychologist. I teach physicians about the nature of pain, and I teach my patients how to cope with it. How about this? How are color blindness, tinnitus, that's the condition where you have ringing in your ears, and chronic pain all alike? Here's the answer. All of these are sensory disorders. Vision is good, hearing is good, and pain is good. All three of those things are helpful. But visual disorders, auditory disorders, and pain disorders are not good. So what the heck is a pain disorder? Let's use the example of a strobe light on a camera. What happens when you're watching a camera strobe when it flashes? Afterwards, you'll probably see a blue dot floating around the room. Now, is that blue dot really floating around the room? Is there a large blue blimp hovering in front of you? Is that blue dot real, or is it in your head? In the very similar fashion, we could ask, is chronic pain real, or is it in your head? Now, both of these are disorders of the sensory system. The blue dot you see after a flash is a real sensory phenomena. Now, there isn't a real blue blob hovering around the room. That's not true. But the phenomena is real. This perceptual after image of the blue dot is real. So it's the blue dot you see after a flash is a real sensory phenomena. Everybody will see it. And chronic pain is a real sensory phenomena. And so saying it's in your head isn't helpful and makes no sense. Both of these are disorders of the sensory system that are real. But like there isn't really a blue blob floating around the room, with chronic pain, there may not be any pathophysiological explanation for what you feel. Sometimes chronic pain is like a sensory afterimage, just like the blue dot. It's a real phenomena, but there may not be pathophysiology there. What this means is that with chronic pain, sometimes there is nothing to fix. Pain itself is the disease. Pain itself is a sensory disorder. Coping with pain means we often have to think about it differently. Stay tuned for the next riddle. If you want to know when more riddles and other videos will be posted, subscribe to the healthpsych.com YouTube channel.